Assalamu alaikum, good evening. Welcome to another episode of Health is Wealth. I am your host, Shabnam Riaz. And today it's wonderful to be here again to be able to discuss issues, a program that was very well received indeed. Program about the heart, cardiac issues, and we have had many questions that have been sent in after the first program, so we thought it's very necessary to have a follow-up on that program, and in fact quite a few more programs because the area is so diverse. So it's our great pleasure to have with us again in the studios renowned cardiologist, Major General retired Azher Kiani, the Executive Director of Rawalpindi Institute of Cardiology. Thank you very much for joining us here again.
Thank you for inviting me.
And, last time in the program, we were able to identify the problems that can lead up to a heart attack, who is at risk, the lifestyle changes that you need to maintain. Today, we have a program that is going to give you more knowledge on the actual procedures, the diagnostic procedures as well, and also the treatment. So, General Kiani, if we could start with this. The Rawalpindi Institute of Cardiology, exactly who does it cater to and what are the facilities available for the public?
Actually, it is a Punjab government hospital and it is catered for the care of, cardiac care of the patients, especially residing in this part of Punjab. But apart from that, I think we have to look after the patients from AJK and from the northern areas, and some patients, they also come from the KPK. Right. So that's around from 10 to 30%. So we have a very good budget, and we cater for all these patients who can't afford it. And I'm very happy to inform you that at least 80 to 90% of the patients coming to a hospital, they're treated free of cost.
That's an amazing figure.
That's an amazing figure. It's like almost, I think, free kind of. This is a very expensive disease where you have to spend, I think, 40 to 50,000 rupees to diagnose the disease.
Definitely.
And what to talk of the treatment? If you have to go in for angioplasty or stenting, bypass surgery, it doesn't cost you less than 250 lakh.
Exactly.
And it's more than 250 lakh. So if you're getting free treatment for that, it's a great, I think, achievement of the government of Punjab and this institution as well. And then we have a system. We have a system of evaluation, the affordability of the patients.
Right.
So we have there's a very elaborate evaluation system where you go for the patient's financial status and what kind of assets they have, what's their monthly income, and what kind of utility bills they pay every month. And so that determines the affordability of the patient. And we've got 4 categories. The 4th category is free of cost, totally 100% free of cost, and you are also given medicine free of cost. Category 3 is where you don't pay for the doctor fee or for the hospital fee, but only you pay for the disposable, the things which are used in the treatment of the patient, like balloons, stents, or in the surgery. If some things is used, you only pay for that, and the rest is free. Category 2 is that you pay 50% of the professional services of a doctor on the hospital, and rest you pay. And category 1 is where you pay 100%. And that's around, I think, 10 to 15%, not more than that.
Right.
And I think I will always call it a paradise for the patients who have a cardiac problem and don't have the money to pay for their treatment of their cardiac disease. And once they come over there, and then they get the free treatment. But they have to go through that process. Actually, for not those patients who come in an emergency, they don't have the time to go through that process. Maybe done later on, but the emergency is totally free.
Totally free.
Yes.
Now that is such important information for so many people who are watching this program, and for the people who cannot afford treatment when they have been diagnosed with a heart problem. This is where you need to tell them to go. This is very, very important. Okay, General, can you also tell us please about widows? You have a facility for widows?
Yeah, no widow is charged in RIC.
Right.
Again, it's completely free for the widows, unless someone widow has a business, has got her own assets, she has got the money, and she wants to pay willingly.
Okay.
Okay, fine. I'm not going to get the free treatment. So then we charge them. Otherwise, we don't.
Do you get patients who are, sort of like we say in Urdu, safed bush? Who are sort of not, it's a bit embarrassing for them to say they have a medical, they can't afford the fees or the treatment as well? How do you sort of?
Yeah, anyone who goes through that system and he does that, then he comes to the administration office and says, in spite of your system, I have some money, but I can't pay for my treatment, so please, I don't have the affordability. And we respect his request,
Right.
and then we make him totally free. So that depends what kind of individual we are dealing with, and
Right.
if someone who doesn't ask for the help, and sometimes I think we request them to go for this procedure, and most of the patients, they say, okay, no, I can afford it, I'll pay for this. And let it go for some other poor patient. So we have those kind of people as well. But where I think the individual it says that as per your system, I have to pay, but I don't have the money to pay for my treatment, so we treat him free.
That's fantastic. That's wonderful. Okay, so in today's program, we are going to talk more in detail about heart attacks and the actual, the anatomy of the heart. And you've brought some videos along that you're going to share with our viewers, and also talk us through exactly what is happening. So if we talk about the layout of the arteries, and we can sort of, for the layman out there and the non-medical person, to understand more of a visual.
Yeah, I think if look at the heart, and if you see these vessels which cause the heart attack, they are lying on the surface of the heart.
Right.
And once they supply the nourishment to the cardiac muscle, and you can see on the screen.
Okay.
And these red and white arteries, they are the arteries which supply blood to the cardiac muscle.
Okay.
And once they get choked or blocked, they cause chest pain or heart pain or angina.
Right.
And if they're totally blocked, then they cause heart attack.
Yeah.
This is inside of the heart, where you can see the valves between different chambers, dividing the chambers and controlling the flow of the blood from, this is one-way traffic. They control one way, and they don't let the blood go back. So these are the valves, and sometimes the patient is confused whether it's a valvular disease or it's a coronary artery disease. So the valvular disease is different and coronary artery disease
And
is
how
different.
are they diagnosed?
They're
How do you know that if a person has an artery problem or a valve problem?
It's different. They have a chest pain if they have artery problem, and the valve problem, they have a shortness of breath or palpitation.
Okay,
Yeah.
okay, right. So those are very, very helpful sort of, visual images that we can have right now. And right now we'll be going for a break. Don't change the channel. Stay with us. Okay, welcome back to the program. Just before we went to the break, General Kiani, we were talking about the layout of the arteries on the heart, and you were describing, how you can see them. The arteries inside and also on top of the heart as well.
Yeah, they're on the top of the heart, and then supply the food and nutrition to the muscles. And once they get diseased and blocked, then they cause the heart attack. I think we should go to the video where I can show you the blockage within the coronary arteries and how that blockage. Okay.
So we have that.
No. We have this video which shows how the electrical activity generates in the heart.
Okay.
And the pulse generates at one place, and then there's a regulator down the side, and from there the rate is regulated and goes down to the ventricles of the heart.
Okay.
And if there is some breakage in the whole electrical system of the heart, then there is a heart block. And then if that heart block is there, then you have to treat that heart block by putting in a pacemaker.
Right.
A permanent pacemaker, initially a temporary pacemaker, and then you put in a permanent pacemaker. And we'll show that, I think, in the next video.
A pacemaker, that goes inside.
Where
is
I
that?
think there's in the next, I think in the couple of slides, I'll show you how the pacemaker is put in, how the lead goes into the heart, and how it's connected to the generator. Can we go to the next slide, please?
Right.
Yeah.
Right.
This is a very important video. I think this is how the arteries look like, and then we're going to go to inside of the coronary artery where the blockage is.
Okay.
Can you freeze it there?
Right.
Yeah, this is the blockage, and
Right.
if I think this blockage is there and there's a 10 to 20% flow going through this vessel, and you have some symptoms while you walk, you get have a chest pain, or you can have shortness of breath, or maybe a palpitation or sweating.
Right.
But if you just follow the do's and don'ts, I mean, you don't exert much at the level of activity which brings on this chest pain. If you reduce that activity and the level of food you take in, and your stomach is full, that causes the chest pain. If you take I think less food and then you don't exert much and you have your 6 to 8 hours good sleep, night
Right.
sleep.
And also emotionally as well, anger you were talking about
Yeah,
as
that's
well,
really very
and
important,
stress.
because these are the things which bring on the heart attack. And with the medicines and with all these precautions, you can live with this kind of a blockage for another 10 to 15 years without having the angioplasty or bypass done, and you don't have the heart attack. But you have to be very, very careful. If you have a disease, take your medicine regularly. Don't overdo the things. Don't overexert. And then have your night sleep 6 to 8 hours. This is really very important. A poor sleep and exhaustion that brings on the heart attacks. And then the loss of temperament, and when you anger.
Anger management is
Yeah,
something
that's
that
really
is
very,
important.
that brings on the heart attack. So it's really very important that once you know that any temperamental variation brings on the chest pain, then please try to avoid
So,
it.
you know, what, again, going back to what we usually see in films and things, that we see usually a male who's above 50 getting angry, worked up about something, he's shouting, and then all of a sudden he's clutching his chest and clutching his heart, and he's having a heart attack. So that is really...
That's real. That's true. That's
do
really
come-
very true.
Okay.
Yes,
okay.
any emotional disturbance that brings on the heart attacks, and you may have, otherwise you may not have this heart attack for another 5 to 10 years. But
Right.
any of those things, they bring on the
Okay.
heart attack. You have to be very, very careful.
Okay,
Yeah.
right. Right. So now you were talking about the blockages as well. The blockages are because of the plaque. What exactly is plaque?
The plaque is, I think, is a fat, and then is a cholesterol, and then there's some other material, the collagen and things like that. And there's a chemical process, and that process leads to deposition of all these things within the coronary arteries.
Right.
And if you are careful with your diet and exercise, and then this process is either, I think, blocked or it is slowed.
Right.
So you can always delay the disease by having these all the precautions, dietary and otherwise exercise. But if you don't do that, and then you have this disease in a very early stage, I mean, your 30s or 40s. Normally, it's a disease of 60s and 70s.
Right.
But in our part of the world, I think this disease is, I think, catching the 20s and 30s as well. Most of the youngsters, they are coming to us with a heart attack in our CCU. So I'm going to show you the next video, and that video explains that how can you have a heart attack with a normal coronary arteries.
Okay, that is very important. So a heart attack with normal coronary arteries, meaning that doesn't have any blockage.
Yeah,
Okay.
you can have a look at the screen, and you can see there is a coronary artery, and you
Okay.
can see some yellow particles into that. I mean, it's nice, he has focused it, zoomed in. There are yellow particles, which are the fat particles, and there's no blockage in the coronary arteries.
Right.
But the moment you start having binges of fatty food, like I think these fast foods or nihari or puri and halwa, these kind of things, that daily having 2 or 3 fried eggs, then you can have...
And how long would you be doing that to
I mean,
cause...
2 or 3 days. even,
just
Bilal.
2 or
Yeah,
3
just 2 or
days
3
having-
days. That brings out the heart attack. You can see there's a normal vessel, then suddenly there's an increase in the fat, and there's
Okay.
a bulging of the inner lining of the coronary artery, and then
Right.
because of the pressure under that, because of the lipid pool, there is a breakage of the covering, and then from there, that breakage, there some material which oozes out into the coronary vessel. So
I
this artery is
see.
blocked,
And
and
that
then
is
it causes a heart attack, and the heart attack means muscle death.
And there
You can
is
see,
that.
yeah, you can
So,
see there.
so what exactly is that?
That is material oozing from this pool, lipid pool or fat
Okay,
pool,
right.
and goes into the coronary vessel, and that pool attracts the blood cells, and that makes the clot, and that clot
Okay.
blocks the coronary artery for some period of time, and if remains closed the artery remains closed for another few minutes or so, causes the heart attack. The muscle is damaged, but then because of natural process, it may break down and restore the flow in the coronary vessel, but the damage is done. You can't reverse it.
Exactly.
You can't bring it back.
And that is so important, because what General Kiani is saying is that just 2 or 3 days from eating fatty food,
Yeah.
halwa puri, the fried eggs, nihari, whatever, and you can bring on a heart attack. Imagine.
I think we had once we had a look at the young patients who came to us in 20s and 30s with a heart attack, and once we did the angiogram, and we saw that this is the kind of coronary artery which does not have any blockage, but they have the fat. I think that's lying inside the coronary vessel and blocking the coronary artery and causing the heart attack. But the damage is done. And that young chap who's 23 or 26 with the damaged heart, he becomes a disabled person.
Imagine.
So it's not a normal heart then. So it's very important that once you are taking a food, you should be very careful. If at all, no food is forbidden. I mean, you can have food, but at least then you should have a break in between. And then you should have a regular exercise or walk. And then the more and more, if you include fibers and vegetables and fruits in your diet, the better it is for your heart health.
Absolutely. So again, such important information. You've just seen that, you know, when you look at things visually, it makes things so much more easier to understand. These are normal arteries, General Kiani is saying, this, people without blockages, just because of having too much fatty food over a period of just 2 or 3 days can bring on a heart attack for as young as 20.
Yeah.
Which is, again, a fact that you don't think of.
No, you don't think of it. Sometimes the patient comes to you with a chest pain and you think maybe something else, not the heart attack. And once you see the ECG and clinical examiner and do all the blood tests, and it's there. So heart attack, and you also fail to believe, and then the parents, they fail to believe, and the patient himself, he says, I can't have a heart attack. But this is they come with a heart attack and they don't realize this thing.
For boys and girls?
Both, same, but mostly the boys, because they are more prone to the heart attacks, as I told you earlier in the last program, that usually the females are protected till the age of 45 or so because of certain hormones, and they have a natural protection. And once that age is over, then they are equally, I think, at risk to having this heart attack. Yeah.
Right, so that's another pointer. So what we're talking about right now is precaution. And this is the purpose of these programs as well. Okay, right now, if you could explain
This is another test of diagnosing the coronary artery disease. This is called CT angio. This is a non-invasive test where you don't put the catheter into the coronary artery. You just put the cannula, give the injection, and take these photos of coronary arteries, and you do the CT scan, and that shows the blockages of the coronary artery, and then you plan whether this patient requires angioplasty or bypass surgery. So that's another way. If you are afraid of having the coronary angio and you think that may not be a disease over there, why to go for this unnecessary test? Then it's important to, if there is some doubt, it's important to have this non-invasive test, which is known as CT angiography, and we have that facility in RIC.
Okay. So what patients would rather have, would you rather advise the CT angio
I think if someone is having a typical chest pain and then his other tests are normal, but he has got strong family history, we are not seeing anything positive on his test, and still we doubt he may be having this problem. So we go for this test. And if this test shows something that we need to go further and do the proper conventional angiogram, then we do the angiogram, and we come to know by this test whether the patient would be needing angioplasty or not, or we should be mentally prepare him for the surgery or not. This test is really very, very informative.
Right. Okay. So we're going to also show some more.
This is the actual video of actual coronary angiography. This is the right coronary angio, and you are seeing the catheter going into the artery, and by giving the injection takes the picture of the coronary artery, and this is a normal coronary artery. And then we can see the, can we go to the next? And then next is the left coronary artery.
Okay. So we'll go to the next slide.
Yeah, this is the left system of the heart. And this is how the coronary angiography looks like.
Right.
So this is the test we usually take 15 to 20 minutes. And patient stays in the hospital for 3 to 4 hours and goes home. And after half an hour, he can take a cup of tea or he can have a light food after that.
And this test will tell you.
This is a gold standard test and tell
Right.
you 100% whether disease is there or not.
Okay.
And on screen you can see this photograph. This is
Right.
how the angiography room or cath lab looks like.
Right.
And there's a table, a patient lying on the table. There are cameras, and then there are some monitors over there. And you perform the test and takes 15 to 20 minutes. And the patient is sent back to the ward and stays in the hospital for 3 to 4 hours and then goes home.
Right. And is the dye, it's okay for everybody? Do they need to have an allergy
No,
test?
that's a very good question. I think that you may have allergy to the dye, and you have to be very careful, and you have to take care of that. You ask the patient in the history whether he has got any kind of allergy, and maybe having allergy to the dye as well. So you take precaution of that. You give injections before that, and we use special dye which does not cause allergy. And this thing on the photograph on the screen shows you the radial part. We do it from the arm.
Right.
The benefit of doing from the arm, from the wrist, is that patient is mobile, and he stays only for 3 to 4 hours in the hospital and goes home. Initially, we had to go through the leg, the femoral artery,
Right.
and patient had to stay 12 hours or 24 hours in the hospital, and he can't move. He can't. He can't go to the washroom.
Right.
So this, if
this
you
is-
do
makes
from the wrist,
recovery.
he's mobile. He can go to the washroom. So it's
Right.
very handy. And then the
Okay.
patient, very comfortable for the patient, though it takes some extra effort from the interventional cardiologist to do this procedure, but for the patient it is
Right.
very comfortable.
What care does a person need to have then after they've had this angiography?
No, initially they have some kind of a bandage which stays there for 3 to 4 hours, and then I'm thinking they're going to move the bandage, and this
And
thing
they're
is gone.
okay
You
to
don't
go.
have to put on stitch.
Okay.
Yeah.
Right. Now, medicines.
Yeah, medicines those are very important. I think once you are diagnosed with the disease, it's very important that you take your medicines very regularly. You don't miss your medicine, because if you miss the medicines, then you may have a rebound of the disease and a very severe chest pain, or may terminate into kind of a heart attack, a heart failure. So it's very important. Once you have a heart disease, it's a lifelong problem.
Right.
So don't take it for a few weeks or few months. You have to take rest of your life, and you can keep on pruning your prescription with the help of a doctor or your cardiologist, and he I think normally deletes the unnecessary medicines, and they try to keep the minimum medicine on your prescription.
Right, okay. So again, once you have been diagnosed that you have a heart problem, it's very important to keep up with your medicines. Now, the next slide that we were going to have a look at, that was the angioplasty, was it?
Yeah,
Or
this is the angioplasty. I can see on top of the screen there is a stent. It's a mesh of wire, and it's a slotted tube. It is mounted on a balloon,
Right.
and it's undeployed. And the middle of the screen, there's a inflation of the balloon, and that balloon then deploys the stent in the coronary vessel, and this stent gets embedded in the coronary vessels and it doesn't move at all. So you take the balloon out, and then there's no recoiling of the vessel, and the vessel remains patent. So this is how the stent looks like. This is how it is mounted on a balloon. This is how it is deployed. In the next video, we'll show you the actual procedure, the procedure,
Right.
video
okay.
clip, yes, animation. This is the blockage.
Right.
You do the angiography, and then you pass the wire through this blockage. This is the blockage. This is a
Right.
block.
Right.
And then this is the wire. You pass it across the blockage, and then you bring the balloon over the wire,
Okay.
and you inflate the balloon, and that balloon compresses and pushes the blockage to the sides,
Okay.
and makes the space for
Right,
stent
for the
deployment.
Okay.
So this balloon is
so
taken out.
that was the angioplasty
That's the
procedure.
angioplasty. This is
Okay.
the treatment. And this is the stent mounted at a balloon and brought to the blockage site. And then it's inflated, the balloon is inflated, and this stent gets embedded into the coronary vessels. So it does
Okay.
not move.
How long does that last? Do they have to be replaced, or are they there for life?
No, it stays there for the rest of your life. And
Okay.
these are the metals that don't dissolve. But recently, there are certain stents which are made of plastics. They get absorbed in 2 to 3 years, and there's no metal in the vessels, and they're called bioabsorbable stents.
Okay.
The metal does not absorb, but those plastic stents, they get absorbed. But we have got 3 types of stents.
Okay.
One is non-medicated, we can call it bare metal stents. Then as a drug-coated stents, medicated stents. And then the third I was mentioning about those who are not metal stents, they are plastic stents, and they are very, very expensive, and they put in the coronary vessel, and they start absorbing after 6 months, and by the second or third year, they are totally absorbed, and there's no metal and no stent there in the vessel.
Right.
The idea of having that kind of stent is that you keep the artery normal. And in future, if you have to go for the bypass surgery and you have to put in a graft on this part of the coronary vessel, it should be available. Otherwise, if you've got a stent in that part of the coronary vessel, it's not possible to put the graft on that part of the segment. So it's not possible to do the bypass on this patient.
I see.
If that segment is stented.
Okay.
Yeah.
What are the side effects? What do people need to be careful about?
The side effect is that it gets blocked if you don't take your medicines. You have to take blood thinners for the rest of your life. For 1 year, if you this is another, I think we'll talk on that later, but this picture on screen shows the bypass, how the bypass procedure is done. On the right side of the screen, you can see there are cough, both two legs, and from cough, vein grafts are taken, and then they are stitched. One end is stitched to the main vessel, which is called aorta, on the top. You can see screen, and the other end is stitched to the coronary vessel beyond the block. That's why we call it the bypass. We call it bypass because it bypasses the blockage. So this is how the vein graft looks like. But in this screen, on the right side, you can see internal mammary artery. This is a artery which is this graft, and this graft has a patency for a longer period of time. The vein graft may blocked after 6 or 7 years or so, or maybe 10 years, if you're lucky, maybe 10 to 15 years. But this graft, it usually, I think, stays there for, if it's properly put in, it stays there 15 to 20 years, or maybe 25 years. And it's a wonderful graft. It's a kind of a natural artery which is grafted to the coronary artery, and that has a longer life than the vein graft.
Okay, right. Yeah. So many people, they hear the word bypass operation and they are worried. We'll talk about that later. I think we've got a slide on the valves. Right, okay. These are
these are the artificial valves. And we've got a different disease, which is a valvular heart disease. And valve is a disease, and either it's a blocked or it's a regurgitant, we call it a leaky valve. Then you remove that valve and they put in this artificial valve. And this metallic, there's two types of valves. One is a metallic valve and one is a tissue valve. And tissue valve has a shorter life, and this metallic valve has a longer life. But with the metallic valve, you have to take blood thinners, warfarin, for rest of your life. And you may get under thin or may over thin, and you may have a bleeding kind of a thing, but you have to be very, very careful. You have to educate the patient, and they have to keep testing your blood all the time and see whether the right kind of thinning is there or not. So this thing is really very, very important.
Right, okay. And this again is diagnosed when you have your angiography, is that right?
This is diagnosed once, it's usually diagnosed on clinical things, and then the right way to diagnose is to do the echocardiography, and echocardiography is a standard test. It's a gold standard kind of a test which tells you about the leakage or blockage of the valves, and then you go send the patient either for valvoplasty, that's the angioplasty, or for surgery. This picture on the screen, it shows how the pacemaker is put in. The lead is put in the right side of the heart into the anchored there, and then on the outside you can see a box over there. This is a pulse generator. This is a generator. You make a pocket in the skin under the clavicle bone, and then collarbone, and then you put it there and it stays there, and it has a life of 10 to 15 years. And once this battery wears off, you can just only remove that box and put another box and stitch it with the lead and have another 10 or 15 years with this battery. So this is how the pacemaker implantation procedure looks like.
Right.
Yeah.
So if you have a pacemaker, that is regulating the heartbeat.
Yes, regulated, because it's a preventable death.
Right.
If you put in the pacemaker, you avoid one death. Otherwise, the heart stands still, and it kills the patient. So if you put in a pacemaker, it gives them another life. So this slide shows where the distribution of the chest pain.
Important.
Yeah, this is really very important. The red dots on the chest shows if you get pain in this part of the dotted part of the chest, means you are having a heart pain. So better you see a doctor. And then if you have a heart pain, the other day I mentioned about the emergency kits. Yeah,
yes.
This is where it contains angicid. You put it under the tongue in case of a pain. and all you can have a Disprin, a normal Disprin tablet, crush it and take it, and then there's a patch, Deponate or Nitroderm patch, and patch you can put on your left side of the chest, and that contains medicine, gets absorbed to the skin, goes to the blood, and opens up the arteries. So this emergency kit you should be carrying all the time. You should have in your house, in your pocket, in your car. Wherever you go, you should have these medicine with you. If you don't need it, someone else needs it, you can help him by giving him these tablets. So this is really very, very important.
Very, very important.
Yeah.
As we talked about this in the previous show as well,
Yeah.
that it's just so simple. It just takes about that much space,
Yeah.
and the medicines are very, very affordable. There's basically no excuse to
Yeah.
not carry that around. I mean, if not just yourself, you may be saving somebody's life.
It doesn't cost you more than, I think, 40 or 50 rupees.
Exactly,
Yeah.
exactly. So that's something you have to have with you as well. Okay, so all these these things that we've been speaking about, these diagnostic procedures and the treatments as well, are all available at RIC.
Well, yeah, RIC. I think feel very proud to say this thing. This RIC, it's a government hospital, is one of its own kind, and it is very well equipped and very well staffed. You name any gadgetry, it's there.
Right.
We have that gadgetry which is not available in other hospitals in Pakistan. And we actually had one procedure we started day before yesterday. It's called angiojet. It's a kind of a machine which, if you can't take the clot out of the vessel during the angioplasty.
Right, and we're watching video of the.
Yeah, this is the RIC. Look, I think we have it's a kind of a model hospital for other hospital as well. Within our own budget, I think we didn't get an extra
and that's
budget.
Special transport.
That's a special transport for the, especially for the elderly patients and the very sick patients who can't walk from gate to the OPD, outpatient department, or to the wards. They are transported from gate to the OPD, and they helps a lot. Then we have got our own escalators and a walk. And there used to be a lift, but now I think there is an escalator, and that escalator works 24 hours.
Right.
And any patient who has got chest pain and he can't climb the stairs, then he can use that escalator.
Right.
Then I think there's hardly, it's being run very professionally, and the patients, they are really very happy, and no one has to go outside the hospital to buy the medicines. They are given, everyone, outpatients or inpatients, both are given medicine from the hospital, and they don't have to go in emergency and look for medicines or other things to bring into the hospital.
And that's the OPD?
That's the OPD, that's the outpatients.
Okay. That is really fantastic. I mean, that's great news, because you find that we're usually, when we're talking about problems in Pakistan, we focus on everything that's going wrong. So it's so heartening to see something that is going right. And, it's really
these things are possible, and these things are doable.
Exactly.
And I mean, the RIC is such an example. I think it's doable. The system is working all right. The people, I mean, this is a kind of hospital. We never had any strike. Right from the first day.
Right.
Our paramedics are professional, our nurses are professional, our doctors are professional, and they work day and night.
Everyone is being well taken care of. That's why
they're so
happy.
passionate. They're very passionate, and they give their best to the patients.
That's fantastic.
And everyone is employed on their own merit. No political push, no sfarish of any kind. So that's why I think they are delivering, and this hospital is delivering.
And that's why you're getting that productivity, which is fantastic. Okay, Janasab, tell me, is the media doing enough to promote awareness for this, this disease that is so deadly? Yeah,
I'm afraid to say they're not doing their bit, their share. I think it's really very important that the awareness and education, I think the media is such kind of tool which you can use, and it can reach to the furthest corner of the country, and the people who are uneducated, they can have that through radio, through print
even
media,
people who are living abroad,
electronic.
Even they can, when they're in Pakistan, they can take advantage of the system as well.
Actually, this is called medical tourism. If you speak of treatment abroad, it's very, very expensive.
Exactly.
And then you have to stand in the queue for months and years to get your treatment. Here, I think you get early appointment for your consultation, then you get appointment for your procedures very early, and then when there is an emergency, then the same day. So you don't have to wait. There, you have to wait for longer period of time in the emergency over there.
Right.
So
Absolutely.
here, I mean, you come in and you get the treatment immediately. I think you have got a time of, I think, 5 minutes. If someone comes to the emergency, within 5 minutes, he's evaluated, then put the cannula in, then put the oxygen mask on, then monitor on, and then if he needs emergency, either the thrombolytic therapy or injection or immediate angioplasty, immediately take within 15 minutes, taken to the angiography room and do the angiography and angioplasty same time.
As you said, and you've been saying, time is of the essence
Yeah,
in a
that's really
situation
very-
like
that
that,
is
and
very
that's why
important.
you've created that whole environment and everything specifically to be conducive to this situation as
Yeah,
it does
not only
evolve in
that, not only
emergency.
that, I have been sending out my teams to different district headquarter hospitals, my cardiologist, the complications and the other modalities of treatment which you don't have, and the patient requires urgently, immediately shift that patient to the RIC. And some hospitals, they are at the half an hour, 1 hour distance, and they
Right.
can have this state-of-the-art equipment
Okay.
treatment available. At
So we're
RIC.
having some, we can see some
Yeah. This
procedures going
is
on.
an operation theater,
Okay.
and surgery is being done. The team is over there, and then we have got a state-of-the-art operation theaters, modular theaters, and other theaters as well, mashallah. And we do have a very expert team of surgeons, anesthetists, nurses,
Right.
and perfusionists, and mashallah, doing wonderful job with very good
Great.
outcome
How
and
many
results.
surgeries are you sort of like seeing every day?
Yeah,
happening
I
there?
think from 6 to 7 a day, and
Okay.
you see, surgery takes 3 to 4 hours, and you have got limitation of the time, and plus the staff and limitation of the theaters as well.
Right.
So that's why the surgery is a little slower, because and the angioplasty a little quicker. I think we have a waiting time of a week or 2 weeks as far as the angioplasty is concerned for elective procedures, but the surgery takes longer than 6 months or so. So because they have got the limitation of the time and the space and the number of surgeons which are available, though we have 6 surgeons, but I think in spite of that, and we have got 4 theaters, but they're doing their best, optimal utilization of the time, optimal utilization of the operation theaters.
Any particular surgery that stands out to you the most?
No, every surgery. I think now surgery in cardiac surgery has become a routine matter now. You see, in surgery, there's a risk of only 1 to 4%, and success means 96 to 99%. So, if someone needs surgery, normally, if someone doesn't need surgery, we can do the angioplasty. We don't send the patient to the surgeons.
Right.
But if someone needs surgery, we don't have any other alternative and choice, and the patient choice is go for the surgery.
Have you ever had a
surgery.
patient that, you know, just a surgery that was complicated or whatever, and you maybe it didn't seem that they would make it, but they did in the end? Some sort of
Yeah,
story
we
like
have.
that?
I think we have such examples every day. And the patient, they get complicated, they have complications, they are reopened again, and they have some problems, and then they do very well, maybe, and then you put in your best efforts and try to save that patient, and you are able to save them.
How much is the willpower of a patient?
That is very important. I think the patient all depends how mentally strong he is. If surgery usually takes, I think, for the patient 7 to 8 days to stay in the hospital and has 3 to 4 hour surgery. But to go back to the work, the one who has got the willpower, he can go back to his work after 1 month or so. But otherwise, it takes for your bones to heal or unite at least 3 months. So it's really very important that you rest for 2 to 3 months, start walking around, but start walking soon after your surgery. That's really very important.
Okay.
And have a good food after the surgery so that there's the strength in the body to heal up that wound as well, and then it helps in healing the bones as well. So that is very important. At the same time, you should be mobile. You should be walking around. And the more you walk around and the more you exercise, it's good for your early recovery and early going to the work. The most of the patients, those who are very strong, they are back to their work after a month or so.
Right.
Yeah.
So, you know, when we talk about the surgery, if somebody has, like you said, in an emergency case, somebody comes along, they had no previous history, they're very young, and all of a sudden they've had this heart problem, they've been diagnosed with a bypass, or maybe it's a single earning member of the family, and all of a sudden they get this news. How do people react? How do you see?
Yeah, this is, I think, it's usually a reaction of a shock. The whole family is shocked. You know, in our society, the male member means everything because he's the blood earner, and he's the one who looks after the whole family, not only his family, but his brothers and sisters, his parents, and his in-laws, and sometimes his in-laws as well. So the whole thing is gone. Everything revolves around him. And suddenly you tell them that he is at the risk of dying. So even if it is a 1 to 4%, but it's still there.
Of course.
And you have more than that risk while walking on the road.
True.
Yeah,
exactly.
But this risk, I think, if you tell them that you kind of you have a risk of dying as well. The ultimate risk is the death. So they are very unwilling to accept that. That's why most of the patients you have to convince them to go for the surgery because no one wants to have the surgery done. They say, okay, something like angioplasty can be done or not.
Right.
And once we are also handicapped, then we tell them no, you have to go for the surgery. But I think you have to convince them. It's really very, very important. And everyone is afraid of surgery, and everyone is afraid of knife and going under general anesthesia.
That's true.
So, but if you have to get it done, you have to get it done.
There's no other choice, and then of course at the end of the day it is being done for you. Thank you very much, General Kiani, for being with us here again today. It's been a highly informative show. There's so much I have learnt myself, and I'm sure the viewers have really, really benefited from today's program. Thank you for being with us.
Thank you very much.
Okay, so we're at the end of today's program. Of course, we ran out of time. There's just so much to talk about. We will, inshallah, continue with this series on cardiac issues and health issues regarding the heart. So important. So please take advice from our great expert who was in the studio with us today. Take advice. Be proactive, and it's prevention, of course, is so much better than the cure. So stay happy, stay healthy. See you next week. Bye-bye.